Jennifer is a longtime peacemaker, part of our community, lives in New York City. Jennifer's an associate professor, assistant dean at Columbia University School of Nursing, and you can she can tell you more about her background. It's lengthy. It's a long and distinguished curriculum vitae. So take a look if you want a little more details. Jennifer, I'm going to mute myself and pass the talking stick to you. So thank you so
Great,
much for
thank
being here.
you. Thank you, Jeff, and thank you everyone for making this happen. This has been a long journey of Jeff asking me to do this repeatedly. Anyway, and I'm very glad that you're here, this circle. This week I will be speaking as if I'm kind of in a circle with you, and I have a lot of different stories I want to tell you. And I also want to, at the end, just show you some pictures so you can see some faces. And then we'll talk some as a group, okay? I'm hoping that that will work for everyone. Can everyone hear me okay? Great, good. Well, I do have to always begin this one. I have to begin by really giving deep recognition to Roshi, Bernie, Glassman, and Jishu, who were my teachers and guides into finding my way into Zen, which I had been looking for a long time, and a Zen practice and an activism, since that's what's in my blood. And meeting them have put me on an amazing journey that leads me here and that I take everywhere I go around the world. So much gratitude to them. And just so you know a tiny bit of where I come from and how I approach things. I grew up in Chicago and Milwaukee, very conservative parents who didn't believe in talking about politics or sex, and wanted to be mainstream, fought to get in from working class to middle class, and wanted to have whatever their vision of the American dream was. And I have an older sister, Bernadine, who's 4 years older than I am, and whatever values they instilled in us turned us both into quite spoken radicals, progressives, out there activists for all of our lives. They always wondered what they had done wrong, and we were always telling them they did it right by raising us in an incredible environment of justice. So I can say it was justice and human rights. They wouldn't have used those frames, but those words, but of really looking at the value of every person and great respect. And by the time I left in high school and went off to college, and I was there a week, and on my first demonstration, I grew up in a time of liberation struggles around the world that deeply influenced me, women's movement and Black liberation, Black struggles in this country. And it was really, those things formed how I looked at the rest of my life, and have always given me fuel, my roots as to my journey of where I have gone. I have 3 children, 3 expanded family children, so 6 in all. And it was through my own childbirths that I really came in touch that I am a midwife. I wasn't a midwife at all. I had a degree in Russian history and 1917 revolution. My father kept saying, but no one ever went to college except you and your sister. What will you do with that? And he was right. There wasn't a lot to do with it. But anyway, how I would get a job. But I came through my own birthing experiences, two of which I had at home here in New York, that I was to be a midwife, and that was how I could serve people. And so at that point, I was a single mom with 3 kids under 5, and put myself through nursing school and midwifery school. And my first journey that I really want to tell you about as a midwife, and walking the path of midwives and healing around the world, was that as soon as I graduated from midwifery school with a master's degree, I was hired to help build a birthing center in New York City. And it ended up being in the Bronx, South Bronx. And it was the birthing center movement, a lot of more upper class, affluent women, and mostly white, were looking for alternatives to birthing from a medical model. And it was absolutely spot on as to where they were going. It also was not reaching out to women of color, and it needed to break out of that. So this was a birthing center in the South Bronx that was to serve women of color. And the community that we ended up working in with the healthcare center, community of Morris Heights, had at the time, about 60% of families were Black families, and about 30% were Latinx families, and then huge number of people from the Caribbean region and from West Africa. So you have a real melting pot. And then that expanded over time because the South Bronx became, if you can imagine, the place where anyone migrating, forced migration, or refugees were settled in the South Bronx first. So we had a very large growing Vietnamese community from people who had been in Vietnam post-war, a growing West African community, growing community from Bangladesh, Pakistan, India. So real mosaic of how you'd want the world to be. And in this community and in the United States, it's still true. A Black woman who was pregnant had a 2 to 3 times higher rate of dying in childbirth than a white woman. And that statistic stands until today, which is another whole discussion of structural racism and what's happened. So when we announced we're opening a birthing center in the South Bronx, there was big uproar amongst the medical community, mostly, who said, oh, women there are going to have too many health problems to be able to birth at a birthing center. Birthing center is an out-of-hospital place. And we, of course, argued that the biggest problem was poverty and no access to good health care, and that every woman had the right to a safe, healthy childbirth, and that that's what we were going to see happen. And when I went to build this, it's really how I now look at the framework of our 3 tenets of not knowing, bearing witness, taking action. Because we had no idea what women in this community would want for childbirth, right? What did they know about midwives? And it wasn't a homogeneous community. It was many different cultures. So the first thing in really being there was finding out what people wanted about childbirth and what they knew, and introducing them to midwives. And that was an amazing, worked for a year at this health center while we renovated a place for the birthing center. And that was a time of me really understanding, learning about the community, and then learning about me and midwifery. And without that time, it would have, we probably would never have been able to do it, because not knowing is central, right? Just going in, trying to go in with a clean slate, finding out what people know, and then and then bearing witness to it, really being open to what's happening. So many of the cultures that were in this community, in fact, all of them, the elder women all knew about midwifery, right? They had midwives either from the South of this country or from other countries. So people knew midwives, and they mostly knew traditional midwives. So coming to New York was like, we'll send our daughters to a hospital for the best care. And there was a huge rate of cesarean sections. There were not good care, not continuity of care. So part was like reaching out first to the elder women in the community, having brunches with them, talking about their birthing experiences, talking about what midwifery today could offer, and bringing them in to actually deciding they wanted this birthing center. And then going to every school in the community, and to every mosque, and to every church with a little leaflet about the birthing center and when we were opening and when you could come and get your care. And you know, for years after this center was opened, a woman would arrive and she would take out this very folded paper from her bag and open it. And it was the leaflet I had handed out 5 years ago. And she said, I knew someday I would be wanting your services. And I just tucked it in the top drawer of my bedroom, and there here I am. So one was really having the community want this. The second was having winning over the medical community, which we never totally did, but at least opening the doors to them, and me going and speaking at grand rounds at hospitals and talking about midwifery and talking about why this community. And ultimately, we ended up having a program where the hospital asked if they could send doctors one by one to witness births at the birthing center because they never get to experience, quote, a normal birth, right? We see medical birth in this country. So it was always trying to get everyone on board to support us. And we were dependent on the hospital because when there were complications and we needed more intervention, we would transfer, right, women to the hospital. That's safe care. And then get them back afterwards for postpartum care and newborn care and women's health care. So it was building that relationship. We also really were very conscious about the staff should reflect the community. So consciously hiring people from the community to be part of the staff, to really welcome, to speak the languages of people coming to us, to see people coming in and feeling like that they were really welcomed there, that this became their center. And we had very limited budget, but I ended up saying people deserve to be treated like queens. Women are coming in. So we had velvet couches and we bought great African artwork. And, you know, I think I sewed the bedspreads out of African cloth. The thing was to feel like a little home and respect that. And what happened, and this is why I start here, because the midwives, one of whom was Nancy Miller, who's not on right now, but she came to work with me. The midwives, we really went on a journey of our own healing, of our own being of use, and taking right action, taking action that could be meaningful for the community. And I carry that with me wherever I've been, and I tell the stories of women, and I finished a manuscript, which is their oral histories, because they're the heroes to me. They are the ones who really were courageous enough to come forward and say, this is where I want to be. One other story about the Childbearing Center of Morris Heights is that very shortly in to this process, and we developed a thing where women we gave them their charts, to read. Seems so simple, but medical records, now you ask for your record and you practically have to sign away all your rights to your family or your loved ones, right, to get your medical records. Well, the medical records are about people, right? It's about your story. So we gave the records to people, they read them, they wrote in them, they participated in their care. This was really saying, the care is centered on you, not us. We have certain knowledge and skills, but this is to make it of what you need for your family. I see June coming in. I'm so excited to see June. One of the things we did is we found, hi June, I was just cheering that you were there, so I'm stopping my little talk. One of the things we did is we noticed very quickly, yay, that women were waiting a long time in the waiting room. And they weren't waiting because they were waiting to be seen. They were waiting because they'd had their visits and they wanted to talk to the other women. We had a big playroom for kids. You know, you make it so you're welcome. And one of the issues had been that women who before the birthing center would go to the hospital, but they would never see the same provider. You might wait 4 or 5 hours, and people had to weigh the balance of prenatal care versus picking up my kids from school or versus keeping my job. They were not fair choices, right? There was nothing about them. And here, women were waiting, their kids were playing. Excuse me. It was very, very centered for people to be there. So then we started putting on pot of rice and beans, and one thing led to the next, and we ended up having women's groups, and we created a women's advisory council. Excuse me for a minute. And it wasn't, it was to advise the growth of the birthing center and the direction, but it was also to have power. So they had votes in what we did, and they determined the direction of the center. Very different if you're going to break through all the structures that prevent people from being empowered about their own health care or their kids' educations or anything in our society. And that was a very important thing that we kept alive as long as we kept the birthing center open. And in fact, my story of obstetricians wanting to come witness birth at the birthing center. And when I first presented it to the council, here were women who had never seen a midwife before they'd come to birth with us, had heard about it from their mothers and aunts. As I said, here were women saying, oh, we're not going to let any doctors in here. They were adamant the doctors couldn't come and see their births. And then the hospital kept putting pressure, so I would go back to the women. I kept telling, this would be a good thing for our acceptance in the community. We'll change the minds of obstetricians. Anyway, finally they said, okay, Jennifer, we're going to make a list of what any doctor that comes here has to abide by before they can come in. And the list was one at a time, only a first name, right? Not that this is Dr. So-and-so, but this is Mika, this is Jacqueline, or this is Melissa, or Annie coming in, or Chloe. This is Jim or Jeff, it was meant to. This person's coming to the birth, first name, the birthing woman and her family had to agree. And this is what they could do. They could wipe brows with a washcloth. They could provide Gatorade in a cup, and they could hold legs for pushing if the woman needed it. And that was all they could do. So one by one, doctors actually came and saw births, and it did change their paths forward about how to treat women and how to be with women. So in the midst of doing this work, my kids getting older, also teaching full-time, I want to tell you about my leap to working in African countries and now much more globally. And that's to tell you a little bit about my late husband, Haywood. So Haywood was my second husband and an activist and a lawyer and a dean of CUNY Law School, and had worked in many countries, starting constitutions and all. And he and I were both big South African anti-apartheid people. And he'd monitored the elections when it happened. And then he went in 1996 to help write the Constitution with President Nelson Mandela. And he went with me 4 years earlier when I met Roshi Bernie in Jishu. And he kind of said he would just drive me there. But of course, he ended up joining and doing all the meditations and kind of came in the backward quote because he said he wanted to keep me company, but it was really his own journey. And it was a very important journey we took together. So he went in April 1996 to South Africa to build a new constitution, was there one day, called me, speaking to the kids and to me, and he said, this is the happiest day of my life. Today I stood up in front of the South African Parliament, which before apartheid had been totally white, right? He said, can you imagine I, a Black man, stood up in front of this Parliament and spoke. This is truly the happiest day of my life. A really joyous moment. And 10 hours later, he was dead. He was killed in a car accident. And one of the things that took me and the children and many people, our close family, through this, because I had this image of him telling me that this was the best day of his life, of that he had lived a full life, died much too early, but lived a full life, and that we would now go through the journey of his death together. Fast forward, I continued doing the birthing center. The birthing center women were part of my healing. They came to my house, they cooked for me. They'd never known what to do to me, right? Because they thought I was always giving to them, but it was really this circle of midwives and the women and the families that I'd gotten so close to. I mean, some families I birthed 3 or 4 of their children. I went through some of their children's deaths as teenagers by violence in the South Bronx. You're so ingrained in this, and they really took care of me. In 2003, so this is 7 years after Haywood's death, I was found an opportunity for me to go for 2 months in the summer when I wasn't teaching to KwaZulu-Natal in South Africa and to work with nurses and midwives. And this began, the link of how the South Bronx was a global community. And this is expanding, but always taking their stories with me, and always learning from the midwives, and sharing what little bit I could offer, but connecting us as a global community facing horrific global statistics about maternal mortality, and newborn deaths that were based on global north, global south, not access to healthcare in many places in the world because of not fair distribution, which is certainly, we find, what's been happening with this COVID pandemic, and refusal to give out vaccines globally, and great injustice. So I went to South Africa for 6 weeks, 2 months, with two very good friends of mine who were doctors. I had worked with HIV in the birthing center because it had hit the community we were in the late 1990s. So we had to go through a lot of re-education of ourselves and the community, and all of our midwifery assistants and everyone, because the community itself was hit hard by HIV. And so I had learned some about HIV care and treatment, but very little. And here I step into the center of a hurricane, a tornado, a disaster. When I went to South Africa, it was this burgeoning explosion of HIV infection. They still have the highest rate of infections in the world. It was a time when the clinic where I worked, 59% of pregnant women coming in were testing positive. 59%. I mean, it's just unimaginable. And there was no treatment. Was there treatment in the United States? Yes, in 2003. There was no treatment for two reasons. One is the current government, post-Mandela, didn't had a policy for about 6 years of HIV denialism, where they denied it existed. And that was deadly policy. The other big obstacle, which eventually was overturned, the other big obstacle was that US pharmaceuticals refused to open patents. So sounds familiar about vaccines, right? To give medications at ways that people could afford, governments could afford in African countries and many places around the world. So there was no treatment. So here I step into a clinic to work for 6 weeks, to volunteer, run by midwives, and who were desperately trying to educate themselves about HIV and figure out what they could do, because it was a death sentence for the mother and the baby, right? To learn you were HIV positive. And then while I was there, nevirapine, which is a one pill dose, was given to pregnant women to take during pregnancy, during labor, to reduce infection to babies, which was the beginning of having antiretroviral treatment, but that was not a treatment for mothers. So birthing your baby and then dying shortly after or during the pregnancy, and then the baby being raised by the grandmother or family or aunt with a 30% chance of being infected. So really hard times, and very brave midwives who themselves, some of them were infected. They were watching their children become infected, their teenagers in early 20s, and no one talked to anyone because the stigma was so heavy. And here I arrive, and they had no idea what I was supposed to do with them, nor did I. So again, back to not knowing, a big not knowing on their part. And I was just volunteering in any way I could. So the page thing about really not knowing, as I learned quickly, is I showed up every morning and I sat at the central desk in a circle of midwives, and they said, well, you can staple folders. Great. So I stapled charts. I did that for about a day. I think the second day they said, actually, you could carry the urine cups when women urinate to test their urine for pregnancy. You could carry them to the woman and then you could empty them for us. So I carried urine for a day. I tell this to students all the time because, don't be impatient. You just have to really not know and see where it takes you. And then one of the midwives said, well, you can't see any of the women because everyone speaks Xhosa. No one speaks English. It's okay. I'm just going to sit with you, whatever I could do. This is the part of just figuring it out. And then it's essentially building trust, right? Them starting to hear my stories, my hearing their stories. And where this led was at the end of 6 weeks, they had figured out how to use the skills that I knew, had reorganized the entire antenatal prenatal clinic because HIV testing had to become central to it, right? Asked me and decided they would come in at 5 in the morning, if I would come in at 5 in the morning instead of 6, so that we could have an hour of discussion about whatever they wanted to know that I might teach about. So you end up with this huge, and they led it, but they needed to figure out what I could give. And I needed to really witness it and be open to whatever they would suggest, right? That's always been my life learning. Whenever you think you have the solution, you really better step back and see, is this what people want? Is this of use? And what do they want? And then figure out how you can contribute to it. It was an amazing time for me and led to me going back for the next, from 2003 until 2010, primarily in South Africa and working in different places. I went back, I'll show you a picture later, asked Nancy Miller to come over, and then we taught HIV basics to nurses because they wanted to know everything. They wanted to know, and I told them about treatment. I debated for a long time, do you tell people about treatment in the US if you can't have it? And yes, you tell people, because that pushes people to fight for it. And it led, besides getting treatment, it led by 2010 for nurses in South Africa to get the right to initiate antiretroviral treatment. That came from nurses and midwives being on the front lines. I spent 1 year working in a very rural province with midwives. And what they did is they could do everything. They could test women and their families. They could prepare them to get on antiretrovirals. They could teach them everything they knew, but they couldn't sign the paper to get the medication, right? To get them antiretrovirals. So that was a whole process of waiting for a doctor who'd come maybe once a month to a rural clinic to sign a paper. These systems really got changed because of the persistence of midwives. And the other thing was, as it became less stigmatized, they talked to each other. In the beginning, everyone, I guess, looked at my face and told me their life secrets, but they didn't tell each other. And I was just a transient person who clearly was interested and had compassion, but they weren't sharing with each other their suffering and their resilience. And that broke down over time. We started to have more and more group discussions, a really important thing. And the last piece of this I want to say is that they helped me heal. We're living in the middle of such horrific death. You would drive on a dirt road into any town in South Africa, and the way you knew that there was a town coming up is you started to see a person standing next to wooden coffins, selling wooden coffins. Kind of just hard to imagine. Those of you, I don't know who here has been in New York, but in the beginning of COVID, in that first March, April, May, there were trucks outside of the hospital where I work at, refrigerated trucks to hold the bodies of people who had died of COVID, 900 deaths a day. You know, people had never imagined this, but many parts of the world live with this, right? And the midwives and nurses are on the front lines, getting sick and dying, but also giving care. It's really a profession dedicated, in my opinion, to social justice and to being present for people. But the thing about my being there is that people knew deaths in ways that none of my friends did. So I was just accepted for me, a grieving widow. And I could talk about when I wanted to with people. I didn't have to. There was such a giving back to me as me, Jennifer, through this time of allowing me to grow and to come to finding joy in life, finding my path forward. And I've always seen that when I'm in countries, when I finally was able, after the restrictions with COVID, to go to Lusaka, Zambia this past February, and got off the plane, and we're out on a runway, and you walk over to into the airport, and I just got down in the crowd and kissed it. I felt like I was so back at home, and that's the gift that's been given back to me over and over and over again. So another expansion was, I always say that midwives are making a way out of no way. Midwives and nurses, it's the awe of survival, right? Of resilience, where you think you can't get past that mountain, but then there's many other people with you to have you go forward. And that's what nurses and midwives do. So I had several grants that were given to me, consultancies. I ended up working for 9 months in another rural area in South Africa with a program called Mothers to Mothers, where pregnant women who are HIV positive would be the main teachers in prenatal clinics, would stand up in a big room with 50 or 60 pregnant women and say, I work with Mothers to Mothers and I'm HIV positive. The bravery, the courage for women to do that when they could go home. Women were blamed as the problem. That's no surprise, right? And we get blamed for a lot of things, Well, the big elephant in the room literally was, how are they getting infected, right? It was not women infecting women. It was, it was a whole, a legacy of colonialism, a lot of people being sent to work in different, of apartheid, sent to work in different areas of the land, and therefore having several families, right? You're gone for 11 months a year, you end up having a family, and then you have your family at home. And so there was a lot of reckoning to do within the bigger cultures about how this was happening. But for pregnant women to stand up and saying, I'm HIV positive, and I now take medication, and I'll walk with you through this path so that you can get treated and that you can have a healthy baby, and your baby doesn't have to won't get infected, and you can live to raise your baby. So the whole sudden access to antiretrovirals, not sudden after long struggles, but change things. And I worked with that group for quite a while, doing some research to validate their outcomes and how successful they were, so that funding could continue. And they were really, really, again, heroes. Some of them had been on death's door when finally someone convinced them and made access to antiretrovirals, and got healthy and had healthy babies and stayed on antiretrovirals and are raising their kids. Real transformation. But it was their resilience, and I got to witness this. My path led me so many ways to witness this. And again, when I could contribute, I design a research project that will give the evidence that'll be needed and get it published, so that there will be more funding. Those pieces I could provide. And then in 2010, I was hired at the School of Public Health at Columbia, still kept my position on the nursing faculty, and we ended up receiving the largest nursing grant from the government that's been given to nurses working in African countries. It's called a Nursing Education Partnership Initiative. And I was the director of this program for the next 5 years. And it was based in many African countries. And the great thing about this program to me was that the money went directly, it was around education. So it went directly to nursing and midwifery schools to manage the money. So it wasn't like it filtered down through many places so that it could get all divided up. And it led me to working in Lesotho, Eswatini, Zambia, Malawi, Democratic Republic of Congo, Kenya, Ethiopia, amazing countries. And every country I went to, I fell in love with the nurses and midwives and the people there and what they were doing. And was mostly helping to set up educational programs that they asked for, whatever they determined. Simulation learning, there's many of us, it wasn't just me, but this is coordinating it all so that it could happen. A great story is my own struggle of still teaching and all has been to learn computers. Humbling when my granddaughter, who was 5 at the time, said, Deanna, I could set up, I could put you on Facebook if you want. I can open an account for you. 5. And I'm like, no, thanks. I'll not do it. But learning computers, especially if you've never learned them, is really hard, right? So schools put in their budgets, buy computers for all the nursing faculty. And then I'd sit in a room with women and no one would open the computer. And, they're looking at me and I'm looking, the hostility is pretty huge in the room. So for some reason, I picked the woman who was looking with the meanest look on her face at me. I have no idea why. And I said, Margaret, we'll start with you. Let's look at how to do the computer. And she went, I do not know how to open a computer. And I do not want to open a computer because I can't possibly learn this. She was shouting at me. So needless to say, we became very close over the next month. But what happened was, I said, I didn't know either, but let's open. And I'd greet tech people and we opened. I went back 6 months later, people had revised how they taught. They suddenly had access to the whole world to look up nursing and midwifery articles. And just this giving, opening the door to what everyone should have, right? The education to do what you want and making it not so intimidating that you can't possibly do it. And each country had its own issues, had its own legacy from colonialism, had its own many, many cultures living within it that had been defied by colonial powers, not people necessarily inside them. But it was in each school's hands to figure out how they wanted to do this and how they wanted to build their program. That's what's important, I think, about our tenets of not knowing and bearing witness and right action is that providing resources and then really turning them over and listening and learning what kind of resources are helpful for people to do this. So 1 or 2 more stories and then I'll stop talking. I was back at the School of Nursing and building a program that I wanted to introduce global health equity into part of our nursing and midwifery education, and also to have students before they graduated experience the leadership and wisdom of nurses and midwives working in many countries, step outside of this system in the United States, recognize the great racism disparity within the United States always, and also learn around the world. And so I've helped build a program now that we have 15 countries, schools of nursing that we work with, and our students go for their last final clinical 6 weeks. And it's pretty amazing. One is in Shandong, China, which is Shandong University of Traditional Chinese Medicine. So they are put into a major hospital that has the wisdom of combining Chinese medicine with Western medicine. So it's layered and totally different. In Kathmandu, Nepal, which was just to go there and go walk in the streets with the largest Tibetan community in exile. And realize how pervasive that is to how people respond. 2 places in India, Amman, Jordan, Malawi, Kenya, Zambia, trying try to remember all the countries, the Gambia, Ghana, Jamaica, Trinidad, Tobago, Dominican Republic, Mexico, to have these wonderful relationships with nursing and midwifery leaders, and to be able to set up this program, and students go and they are under the leadership of nurses and midwives there. They see incredible resilience. They see creative ways of learning how to do care for people. Many sites they witness unacceptable amounts of death, and we need to work through how they can put this into, just like I did in South Africa, of learning about how often women, I'd never seen women die in childbirth, even though I taught it until I was in South Africa, and then how it changes your perspective on what is the lack of human rights in so many places. So it really is a wonderful experience for students to kind of get completely immersed in this and put themselves, big courage into learning a whole other experience and bringing back the resiliency and in many creative ways of how healthcare can be given. When Ebola broke out in 2014 in Sierra Leone and Guinea and Liberia, I was haunted by the picture, which I will show you in a moment, of a picture of Josephine Findeselu, who's a midwife in Sierra Leone, and she was half a page of the front page of the New York Times, and a tear was running down her cheek when they caught the picture, and 14 of the 27 nurses and midwives on her staff had died of Ebola. And I always taught students about her. I didn't know anything that happened. But then I became part of an oral history project in New York City and got a grant. And we went to record the oral histories of nurses and midwives in working on Ebola. And I'm in Sierra Leone. This is the beauty of what I get to do and the resilience and why I'm so impassioned about it. So we're recording interviews one after another of nurses and midwives, and they're telling the stories. And Ebola, for those of you, is transmitted by skin contact and fluids, and has about a 50 to 90% fatality rate. So highly, highly explosive. And rituals for death in the country involved being with the body, bathing the body, eating with the body. The whole community would travel. So, and then that people became infected. So it meant looking at all of that. But anyway, so I go to do these oral histories, and I keep asking the nurse, Joan Shepherd, the head midwife at the school, do you happen to know Josephine Findeselu? Is she coming? Will I get to interview? So she said, yes, she's coming, and you'll get to interview her. So the first day, nothing happened. She didn't show up. I'm interviewing many people. The second day she comes in, and she, of course, didn't know that I was a complete groupie. I run up to her and I'm like, I know so much about you, and I'm just so glad. And I did her story. And we still email each other every week. It was having her story known to the world about what she went through and what the nurses that she supervised and that she was with as they died from Ebola, what they went through. And that led me to, when COVID broke out, what can I do? What can I do with the school nurse? I could go in and be a midwife. Is that really going to be helpful? Is it not? We did organize our students, nursing students, because we couldn't go global. Those who wanted to could volunteer, and they went in to the hospitals and worked right from the beginning. One student came to me and she said, the shifts were midnight to 8 in the morning. And she said, and these people haven't graduated yet, it's their senior year. She said, the first night I went I got on the shift, and the whole hospital was being changed into a COVID hospital. And the head nurse said, you're going to come with me. We're going to do a post-mortem. The woman in this hallway just died. We're going to go and take care of her, and then you'll do the rest that night. So the student's eyes, as she's telling this story, are just gigantic. So she goes in, and clearly this is an example of what nurses and midwives do. She follows the nurse, and she's quite frightened, the student. And the nurse says, Mrs. Hernandez, I'm here to clean you up, and I'm going to dress you in white, and then you're going to get to go home. And she talks to her the entire time that she takes the ventilator and the IV out, and that she bathes her, and that she wraps her white shroud. And she says, now you're ready to go home. Thank you for letting me be with you. So the student goes out, and she did 6 more that night by herself, April 2020. So we're looking now at students in students, but also all the nurses and midwives in these hospitals. How are we going to absorb how can we help them with the trauma? What they're seeing, and they're seeing their colleagues die. Something that did not happen, quote, in this country. So I got the dean to agree, and I organized what I called circles of care. And they are our councils. I kind of stretched the thing, but I read the 3 tenets in the beginning. I tried to get to the essence of what we do, which is what I've always learned, sitting with you, Jeff, sitting with other people I sit with. I'll get to the real essence of it. So we rang a bell, and we would sit quietly. We talked about just breathing deeply. And this is all on Zoom with nurses and the students. So, and then sometimes I would give prompts, because I found if we just sat in silence, no one then spoke, because they kind of didn't know what they were supposed to do. But would anyone want to share what they've seen this week? And one by one, people would get on, and it was just like the floodgates had opened. One nurse said, I see them, I take them wherever I go. Meaning all the people who had died, they're with me. I see them constantly. People they didn't know how to regroup. They didn't know how to function. And we did those healing circles of care for about 6 months. And then people got used to it. You come in, you never had to speak. You could just stay mute, just like we do our circles now. It's finding ways, always finding a way out of no way to be present to what's happening, and to give whatever we can back. I've always been a constant learner. I still am. I feel honored that I have some of the best teachers in the world, amazing nurses and midwives who I talk about to wherever I can. One of the most important things I've learned is sometimes it's just the most important to show up, which I would say is bearing witness. I remember when I would go back every 6 months to KwaZulu-Natal, to Sir Edward's Hospital, which is where I started telling you my stories. The first thing the midwives would say is, you came back. It wasn't like, oh, what are you doing here this time? Or what are you going, it was, you came back. The thing was that you're walking shoulder to shoulder, whether you know what you're going to do or not, but you're showing up. It's just being there. And I feel like there's so many in this stories I'm telling you, there's so many people who know what to do, the midwives and nurses on the front lines, but no one ever asks. And so we get cut off from truly the power. We're the largest health cadre in the world, but to hear our voices and what we witness, it's part of creating spaces. Sometimes it's a little pushing the door open more than waiting for it to open, or sometimes even non-violently knocking it down, however it is, but getting through, because they know we've been on the front lines, and we always will be. And just giving that space, because nurses and midwives really are the healers of communities, physically and mentally and spiritually. And it's a very great responsibility, and then helping us take care of ourselves and support each other through what we need is very important. And and I'm so grateful that I get to do this journey. It's really my heart of finding of what I can continue to do. So let me show you a couple pictures and then I'll stop talking. I have no idea how. Oh my goodness. See, I told you in the beginning when I said I may talk for 20 minutes, right? Holden is bowing. Yes, you never know when I get wound up. So just a couple of pictures, and this is some of the stories I told you. I couldn't put up everything, but first the birthing center. So this is the sign you'll see on our left, the childbearing center of Morris Heights, El Centro de Maternidad de Morris Heights, and in the Dar la Luz picture on the thing. And what you see on this front door, you can't see it very well, but if you look down, there are bears. There's a little, not, it's a little too gender designated, so apologies. But we had a pink bear and a blue bear. And every day, whatever baby had been born there the night before, we would then put that baby's name on the bear and put it up on the door. And it got to be this main pathway to the subway. Whatever, you could watch people in the morning running for their subway, and people would look and see who was the newest member in their community. Just a simple way, but a great way to announce this is special. You have a new person in your community. The top is a woman named Marilyn. She's with her newest baby, a little girl down there. Her two boys are with her. This is 2 hours after her birth at the birthing center. A woman who went on to work a lot at Morris Heights, and her oldest son, Luis, who's up on the upper right corner, was shot to death on his 19th birthday. And I actually flew back from South Africa and went to the funeral home and sat with her and her family, and we ended up doing breathing, just deep breathing whenever a wave would come over. And then she said to me, "This is like our being in labor again together." And I said, "It is. It's the other transition that we're marking Luis going through." And on the bottom is Zakia and her baby, Chua Odingus. Next picture, just to show you some of the faces. So this is the first time in South Africa. Upper left-hand corner is Marie with the head midwife, Maria. And we're doing abdominal palpations, which is seeing where the baby's lying and how it's growing. Top right corner, the group of midwives who ran the labor delivery. And the bottom picture is Nancy Miller. This is 2004, teaching HIV basics to a group of nurses. Next one. Go back, yeah. Okay, so these are some of the top two are midwives I worked with in Eastern Cape Province, who were just pioneers in going into the community and getting everyone to come into prenatal care and get tested for HIV. The bottom one is the new baby. I just love this baby looking up at the mother. It's always a sign of hope to me. In a clinic I was at. Next one. So this is during the period when I was doing the larger African project for nurses and midwives. On the left, it's two nursing leaders, one from Swaziland and one from Kenya, that I took to the World Health Organization, and we did a presentation there. On the right is a nurse and midwifery wellness center that was started in Estawini, which is formerly Swaziland, and very small country. And during the HIV initial outbreak, average life expectancy went from 55 to 30 in a year. So they created a wellness center for nurses to come and try and deal with the trauma of what they were experiencing. Next one. Jeff, are you putting them down there? Great. Okay, so this is Josephine Findeselo, And on the left, you see her when I first saw the picture of her in the New York Times with the tear coming down her eye. And on the right is us in 2019. And I showed her the picture from my PowerPoints for my students to show her how I always am. Everyone who's ever been in any of my classes knows about her and knows about her heroism. Next one.
It's a little sluggish here. It's
I know.
there
Won't take much
we go.
longer.
There we go.
Okay, and this is the Ebola. It's a website that we put up. And if you go on to this, you actually can hear each of the nurses and midwives we interview speak. It's just a great one to do. Next one. And this on the upper left is the students. This was the first year. Last 2 years, we couldn't send people. This is on the left, is us in the School of Nursing and all the students. We sent 50 students to 10 countries this past April to May. They have just returned a week ago. On the right, here is me 3 weeks ago in the Gambia, Western Africa, with the students who are all, Columbia students who are all in blue, they're all midwifery students. And Jariatu, who's the head nurse, and Mamadou, who's the head of the nursing school. The bottom is the picture of, before I left, we had a big celebration and they had a beautiful dress made for me. You can see we're all dressed in great outfits. Those are the heads of the midwifery program. Next. That's it. And one more, there's one more on here if you go down actually. And this is the poster that's outside New York Presbyterian Hospital that was dedicated to all the nurses and midwives. And I love it. It's still up every day you go by it. And it's a thank you to everyone serving their community. So, and thank you for listening. I know I talked a lot.
Jennifer, thank you so much, and thank you all for being here. We've got some more time, so let's, if you'd like, let's lean in a little bit. And if you have observations or questions or comments for Jennifer, please. And it's a nice small group, so you can just wave your hand and unmute. I don't think we'll talk over each other too much. Annie, hi.
Hi, thank you so much, Jennifer. That was really a heartbreaking story. Beautiful, hopeful. I have a question, which is what are your biggest challenges now that you face the midwifery, and have you seen a greater acceptance of midwifery since the very beginning when you began years ago?
Thank you, Annie. You know, part of what, in terms of your first thing, I'm always very conscious about the resiliency, because oftentimes people focus on suffering. Oh, those poor people. And that's not, I don't think that's what our practice is about, nor is that the right thing. It's looking at great grief, sadness, and how people sit with it. How and what do we do in it? Just like now, yesterday, just in between Buffalo and Texas, you know, you just, what do we do? The despair, the paralysis, you know, how do you find the resiliency? And my story of telling the story is really the remarkable heroes of people facing horrific thing. Unfair. It doesn't have to be like this. We have the resources to have a healthy planet everywhere, right? Thriving and everyone fed and living to their highest attainable level of health and education. And, you know, instead we're destroying everything. It's everything around. So how do we do this? So it really is always trying to show the remarkable resilience of people. And also to acknowledge it shouldn't have to be that way. And in spite of that, we do that. So, you know, midwifery is the oldest profession. We're always going to be around. It's in every country, it has its own struggles. In most African countries, all nurses are midwives. You couldn't leave nursing school without learning how to help a baby be born. Not so in the US. No surprise, we carved our own. And there's surges of midwifery. You know, when I first came into, had my degree and started building the birthing center, every major city hospital in New York City was run by midwives. Well, then the medical profession decided they were losing too much profit, and we were all downgraded to supportive roles. Will we come back? Yes. It's going to keep what we do is just too central to women and families and communities. I mean, in most communities, why the nurses and midwives were so key, for example, around HIV in South Africa, is they're the respected people in the community. And same thing with Ebola and COVID. This country is different because we do not have a strong public health system or primary healthcare system, right? Where we all work, healthcare starts in the community, like the birthing center. But every other country, you know, that's where it starts, in your community health center. And who's there? A nurse. In many countries, if you see any health provider during your lifetime, it'll be a midwife or a nurse. So I don't have an answer. You know, I work with WHO, which now has for the first time since 2018, has Mrs. Elizabeth Eru, who's a nurse midwife, and the inner circle of policy. Can you imagine the World Health Organization? And they say, oh, many thanks to nurses and midwives. They've never allowed one of us to be in their central leadership group. 2018. And I met her in Australia at a meeting shortly after she received this appointment. And she said, we were all cheering and, you know, hanging on her, under her. It's about 50 of us. And she said, I want you to know three things. I have this position. 2, I have no budget for the position. 3, I have no staff. So let's roll up our sleeves. It meant all of us had to take on this work with her, you know. And yes, she's getting hurt. And yes, so is that going to change everything? No, but it's at every step opening that door. So we're not going anywhere. We're always going to be around. It's harder when I see New York, see birth so medicalized in this country. You know, the solution is not more midwives and birthing centers. The solution is more and more and more high-tech intervention. And, you know, I've been in places in Nicaragua where midwives would come from the mountains and say, what do you do when there's a placenta previa? Placenta comes first. So it's death to the baby for sure, and high risk of death to the mother. And I say, we go to the hospital. I want hospitals, you know, I want doctors. I have my own expertise, midwives do. Doctors have their own. We work together. But the path of this country is just medical and profit. So we'll come back. And in many countries, it's thriving. So I don't have a big answer, Annie, but it's, you know, this is going to keep going.
Thanks, Annie. Anyone else?
I just wanted to say aloha, Jennifer. Nice to see you.
Oh, June, I love you. Big hugs to you.
Big hugs to you. Thank you so much for the work that you're doing and you've done for women around the world. Thank you so much.
And right back at you.
I've got
Thanks,
to
June.
go. So,
Thanks for your comment, June. And looking forward to seeing you in a month and a half, too, by the way,
great.
in the Black Hills. Yeah.
Yeah.
Anyone else have a comment? Yeah, Myoshtin, Mika.
Thank you, Jennifer. It was beautiful presentation. I'm a chaplain by trade, and I have to say, you are a great chaplain. And I never realized what great spiritual caregivers the midwives are, you know. And I was really fortunate to have midwife, 2 midwives to help me birth my son. It took me, you know, my labor was like or 9 hours. And, there was a midwife, and then she had to leave. And then I was thinking, oh, please don't let it be a doctor. Let it be a midwife. And I was really lucky to have a midwife at Kaiser, and at the time my experience was like, prenatal was great and birthing was great with a midwife, but there was no postpartum care.
Postpartum. Mhm.
Care at all. And and I was really depressed, and you mentioned postpartum care, and I wish I had that, to know how to deal with depression. I knew about postpartum depression, so I dealt with it, but all by myself, So anyways, I have a question too. You've been involved in so many projects and research, and your group of midwives was champion some of the systemic changes for birthing, and especially in minority sections. And I'm wondering if you have any publications around your research or projects. I'm personally interested because that's the area of my research, female healing and spiritual care, so I'm wondering if you have any publications or anywhere that I can go to look at.
Yes, I can send you some things. We can find a way to distribute it. So I have some, and I have other resources. Very important to do, right? I'm at a university, we have to publish, but it is important to get the word out. And we did publish the circles of care also, our story about circles of care and using that as a way to heal, a tool that could be used. There's a whole international group called Healing Circles that will help you set up circles of care. You all don't need to set them up, we have them. But when I went into this and wanted to do this, I found that there was lots of evidence, which you need if you're at a university to say there's evidence. And it was really an interesting thing for me to take that out of the practice that I do and and try and get to the heart of it. And for nurses who were just in agony by what they were seeing, and no tools to deal with, For nurses, it had a particular toll, the pandemic, because we always, nurses hold hands. We go through death with people. We go with families. And suddenly in New York City, you couldn't get to anyone. There were so many people dying. People were dying alone. You couldn't let any family in. I mean, this is the beginning time, there was just no communication. And so they felt extra powerless because this is what we do. And you'd go out of the room and you knew, there were 6 people waiting for ventilators, and you'd come back an hour later and 5 had already died, and you couldn't say it. You weren't there. You missed it. So it's just awful. So that part of healing is so important. But anyway, I'll be glad to communicate with you and send you the things I can. Okay.
Jacqueline, please.
I just want to thank you for the work you're doing. It's so wonderful. I've been real interested in how meditation can support the birthing process. And I went through my birthing process using Vipassana meditation, but it's a hard sell. I mean, nobody wants to do that. And I'm just interested in if you have anything to say about translating the great value of meditation for mothers, for people giving birth, mothers while they're giving birth, postpartum, it's just so valuable. And if you have anything to say about bridging that gap to bring that to different people who, without any jargon or
Yeah,
having them to do anything to change
well,
their religion or anything.
right, that's a big question with well, I'll give a little answer. I mean, why I said that the healing circles, which isn't about birth, but the circles of care, was my just feeling plunging forward, and why not try this? And it's so much harder on Zoom, but look at what we do. You know, we figured it out, and then to communities that were in trauma. So not like just introducing it and then also have it not what we'd say religion, you know, but Zen Buddhism is kind of all spirituality. It's the practice of meditation. The thing where I got to with birthing is that birthing's about the breath. And so that's how you link in. It's about getting the breath. When I had my first pregnancy, I did Lamaze. I had a 40-hour labor. So Mickey couldn't say, yes. And I was on stage 4. There's only 4 phases of breathing in Lamaze. I was using stage 4 when I was 1 centimeter and I had another 38 hours to go. I mean, you know, but I was like stuck. This is what you have to do. Well, by the time I was building the birthing center, people just don't do this. We gave classes, a lot of classes about what to expect in birth, you know, and then everyone says, you never told us. This is, you know, Jennifer, you never said it was like this. Well, that first contraction starts. How can you ever describe it to those of us who birthed? You can't. But anyway, so by the time I was doing this as a midwife, down to really getting, again, the essence, just like the essence of the 3 tendencies, is how do you take the breath, which is so critical, and get everyone to get into their breath to go through the birthing process. And then you kind of keep going on. And one of the beautiful things of having the birthing center is that we saw women right after. So, Mika, yes. So we saw women at one day for their pediatric, they went home in 12 hours. Then at one day, and then we saw them at day 3, and we saw them again at day 6, you know, day 7, week 1. And there was no thing like waiting 6 weeks to have a postpartum visit. We were in it, so you could work much more closely with women about how to face heavy hormonal changes, the devastation of all this care that's being given to you, and then no one sees you and you're left alone, as if we instinctually are supposed to know how to raise a baby. You know, it's so unfair to women, another real cruelty done. But one of the things I used to really do is whenever I saw a woman who I'd been with at their own birth, I would say, I want you to know I saw everything. I was with you through everything. And then someone say, oh, I'm sorry, I tried to bite you. And I'm like, you know, you were laboring, or I'm sorry, I was pushing you with my, oh, I'm sorry, I said this, you know, I'm like, wait a second, you know, and you were stellar. I saw you go deep, 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 deep into yourself to have this baby. And you say that to women who get transferred and have cesareans, to everyone who's gone through this. And I said, you have that in you. And I saw it, and you know it's there. And no matter what happens in your life, you can go back and remember. Remember, I do have that in me. And that's the beauty of transformation, where you really help someone, not just that they think, oh, I wasn't so good in this, you know, I could have done better in labor, or, you know, what is this judgment? And the ability to simple words to say, I saw you, I was with you, and you have a warrior in you of compassion and love, and no one can break that. No one can ever take that away from you. So I'm going off a bit, but the power of how you rephrase and you give back to people. Same thing to nurses or midwives on the front line. I've watched you, and I know, I feel everything you're facing, and you within you, you are a hero. You may feel like you're not doing anything, but it's there, and no one can ever take that strength from you. That's one of the beauties of doing midwifery and around the world, is you get to see that in everyone. And we are so hesitant often to claim it in ourselves because it gets taken away from us so quickly. So
Yes.
that's it. Maybe we
Yes.
should go sign off. What you think, Jeff?
I want to just toss in a comment here. I wanted to share. This is so typically and usually a women's topic, but in my case, it's not. All three of my kids were born under the care of midwives. Two of them were born at home, and one of them almost was. We ended up having to dash to the hospital, but we were in 1980. We were kind of part of the cult of Ina May Gaskin and Mothering Magazine. I think Jacqueline.
Spiritual midwifery, right?
That's right, yeah. And I mean, it was religion for us. I think Jacqueline and I maybe have talked about this once before. Um, and we didn't have a lot of support around us. It was, in 80, it was, you were a little bit off the radar if you were doing this. And I was nervous to talk to my mom about it. And she said, "Oh, hell, I was born at home." So she said, "You'll be fine. You'll be fine." So, and I don't want to just take up a bunch of time telling stories, but uh, of my three kids, my youngest daughter was born in '86 in LA. And by that time, we were so nonchalant. We were in our apartment in LA with two midwives, two like trainees, four friends, my wife and myself, and our two kids, all sitting around this giant dining table having fried chicken. And my wife a contraction would come, and everyone would stop talking for about a minute, and then she'd relax, and we'd go back to yakking and eating fried chicken and stuff, and it was just so not routine by any means, but it was just appropriate. It was just this is just how it should be done, and anyway, I wanted to share that to have kind of that personal connection with midwifery.
That's so great. And so I have to tell another little round here, and then you'll get tired and you can all sign off. And first of all, in most African countries, the majority of midwives are men. So very interesting. Yeah, and I had one of my group that I didn't point out, Jake, who's been a dancer and is now becoming a nurse midwife, who went to the Gambia with me. And he said, "Do you think it's okay? I'm a man going there." And I checked with Mamadou, the head of the school. He said, "Most of the midwives here are men." So anyway, it's an interesting, I had to loosen up my ideas about it. But it's the role of men. It's so in the birthing center, we had all, anyone could come in. Kids could be there. They could be in the playroom. They could sleep there when you were in labor. It was just anyone that the woman wanted in. So it brought in, families, and it brought in mothers, and it brought in best friends and all kinds of things. And if you didn't want them, they could sit in the waiting room, or they could go cook food or whatever they wanted to take a nap. But so men were constantly being brought into the birth. And so we had to prepare them. And also want to say, in this day, I'm learning, this is very important as a teacher. So we also talk about birthing people, because we open the whole issue about the whole reality of trans and breaking through binary stereotypes and all very different turf that I'm learning how to navigate, and that globally is a big hard thing. If you said a birthing person instead of a birthing woman in most of the countries that I work in, but it's out there on the table. So we had all these young guys and not so young guys. We had older men who had kids. Anyway, people have never been at births. So we had to do classes for the men. And then one of the things, I always used to do a big thing for Mother's Day, and we'd have an open house and people bring in food, and we'd bring food in, and sometimes we had jazz, and anyway, everyone would come for Mother's Day. So then we had Father's Day. One of the two men that I was fathers that was very spoken up, he said, "What about Father's Day?" So we have this event for fathers who have birthed children at the birthing center. Many times it was the first child they'd ever seen be born. Anyway, so I'm thinking no one's going to show up, and then I'm thinking no one's going to want to talk. So I, of course, planted two people. Two of the men, I said, "Okay, when I open this, I want you to tell your stories," thinking that at least someone would be saying something about the experience of the birthing center. So It was at nighttime. I think 80 men showed up. And we opened it up. I read poems. The two people I asked to speak, and then they were sitting in a huge circle, and people said, well, I want to tell my story. We were there for 3 hours that night, and every man had to tell his experience and how it had changed his relationship to parenting and to the person he had the kid with. It was just fascinating how when you this thing about just no assumptions, and you open the door and you give people information they need, they'll figure it out. I mean, I had several men from Mali, for example, where in Senegal, we had a big Senegalese community, where men were not supposed to be at births. And I worked out with the mosque in our neighborhood that an imam would come in at the end of the birth, and I could bring the baby out, and all the elder men, young men would form a circle, and they would bless the baby. You could incorporate all these rituals, very important. But men weren't inside the birthing area. That was women. But here they're in the birthing center, and their families are away. And I never said you need to be in the birth, but by getting to know us over time, men all asked to be in the birth. And it wasn't like you're breaking culture. It was them deciding I'm the closest, my wife's mother and her sisters are all in Senegal. I'm going to be with her, and she wants to be with her, And when I first was in midwifery school, I was working at Beth Israel Hospital, which has a very large Hasidic community, and Hasidic men, I don't hope I'm not stereotyping, were not historically let into births. And I had one man who came to me, it was her 5th baby, and he said, my wife and I have agreed that I can see this baby be born. I've never seen one. And I even asked our rabbi, and he said, we can see this. And he went in, and when she was pushing, he ran around and he looked at this head emerging, and he was ecstatic. And they were both ecstatic that they got to share this with one kid, that he actually got to see the baby come out and be born. So it's very, again, I'm not saying break through cultural traditions, but respect them and open it enough where then families can make their own decisions.